Hello everyone, I'm Mary Rose Corrigan, Public Health Specialist for the City of Dubuque, with the March 30th, 2022 update from the Dubuque County Public Health Incident Management Team. Since February 2nd, COVID-19 cases have been on a steady, steep decline. And as was predicted, the Omicron variant increased dramatically after the new year, and the declining number of cases continues. Even though do-it-yourself home test kits are not reported in these numbers, all of our other indicators, such as low hospitalizations and deaths, also indicate low community transmission. Likewise, around the U.S., most communities are in the low community level, like Dubuque County. Other countries around the world, however, are seeing different trends, including increasing cases of the Omicron variant and its subvariants, BA1 and BA2.
Wait a minute, Colleen. What are you doing here?
Hey, I was just walking down the street and your director called me over, told me you were late for taping. Tried to tell him I wasn't you, but then I thought, let's start an April Fool's and see if people really can know the difference.
Oh, really? Well, sometimes people think I'm you. But I guess I could use a break, and since we do think together telepathically, tell them what you know, sister.
Okay, just because cases are down doesn't mean we don't need to keep our guard up. You can continue to protect yourself and others by staying home when you're sick, getting tested if you have any COVID-19 symptoms, and you can do that using a home test kit, a mail-in Test Iowa kit, through your healthcare provider, or a community test site. However, the best thing for preventing COVID-19 is getting vaccinated and staying up to date on recommended boosters. Vaccinations are still available at the Dubuque VNA, drugstores and pharmacies, and through your healthcare provider. Finally, as always, if you're around someone who has symptoms or a crowded indoor space, it still doesn't hurt to wear a mask, especially if you're in that kind of setting on a regular basis, like for work or recreation. Another thing to remember is to plan well in advance of any travel, especially outside the U.S., because different areas of the globe are now having increased cases and Omicron surges. Check the CDC travel website often so you know the testing and vaccination rules, where you're going to, and where you're returning from. How's that, Mary Rose?
Right on the money, Colleen. Nice job. There's also some new information regarding vaccines. Yesterday, CDC expanded eligibility for an additional booster dose for certain individuals who may be at higher risk of severe outcomes from COVID-19. Boosters are safe, and people over the age of 50 can now get an additional booster 4 months after their prior dose to increase their protection. This is especially important for those 65 and older and those 50 and older with underlying medical conditions such as cancer, kidney, liver, and lung diseases, dementia, diabetes, heart or brain health conditions, overweight and obesity, physical inactivity, etc. Data continue to show the importance of vaccination and booster doses to protect from infection and severe outcomes of COVID-19. For adults and adolescents eligible for a first booster dose, these shots are safe and provide substantial benefit. In fact, during the recent Omicron surge, those who were boosted were 21 times less likely to die from COVID-19 compared to those who were unvaccinated, and 7 times less likely to be hospitalized. CDC continues to recommend that all eligible adults, adolescents, and children 5 and older be up to date on their COVID-19 vaccines, which includes getting an additional booster when eligible. Finally, regarding testing, another reason to get tested early if you have symptoms is that we now have medications that can prevent and shorten COVID-19 symptoms if you are positive. This could result in a milder illness and greatly decrease the chances of ending up in the hospital. And regarding the current state and what's to come, we're not exactly in the endemic phase of this pandemic. If we were, COVID-19 would be more predictable. And if it's one thing we've learned in the past 2 years, it's that COVID is not predictable, at least not very far into the future. So the pandemic, or worldwide spread of a virus that's only 2 years old, continues. Anything else, Colleen?
As a matter of fact, yes. Let's all be considerate of our healthcare providers and those in the hospital by continuing to wear our masks in those facilities. Healthcare is a vulnerable environment for both staff and patients, so masks are still required at doctors' offices and hospitals. So be nice to our healthcare workers in those settings. They continue to make sure we're safe, even while under their care. And even though I tried to fool everyone today, the information we provided is no joke. Just wanted to get a head start, April Fool's Day, settle this nonsense about me being you.
Of course you're not me. But Mom always did like you best, just saying.
So true. But you were Dad's favorite golf buddy.
Well, there's that. In closing, you've been seeing and hearing a lot less of me and from the Dubuque County Public Health Incident Management team lately. Going forward, I'll be doing these updates only when our public health guidance changes or something different starts to happen with COVID and the pandemic. Of course, when there's another public health emergency, I'll be back, but let's hope that's not for a long time. And I may occasionally provide a few health tips. In the meantime, stay safe, be healthy, and
Happy April Fools!